Everyone, let's bring this Health and Human Services Committee meeting to order. It is 3:45 p.m. on August 20th, 2024. We will start off our day with the Health Department Director.
Afternoon.
I've got no resolutions for you all today, just my director's report. So if anyone has any questions, I'm happy to answer them. It's a very busy month, but summer usually is.
Well, according to page 1, you have everything but the bubonic plague.
Yeah, just about, a little bit of everything.
Anyone have any questions for Director Victoria?
For COVID.
No, our COVID numbers are up. Unfortunately, I myself experienced this firsthand. It kicked my butt. Yeah, so no fun. Our hospitalizations aren't jumping, so that is good. But we are getting more positive reports coming in, which we weren't really. We're seeing a lot of home tests, which we don't get those reports, of course, but people are going to urgent care. Doctors, if their doctor will test them, or going to the ED and getting tested. So they must be feeling bad enough.
I actually read somewhere, they said 1 in every 47 people.
Yeah.
COVID death.
Well,
Yeah.
a lot of
COVID tests aren't free anymore, so
Right.
Right, yeah.
What is
But
the
the-
most, oh, go ahead.
No, you can proceed.
What is the most, current, guidelines?
As far as what you should if you're positive.
Work, yeah, I read
So-
it, but I'm not sure that it was the most current.
Yeah, so the recommendation from the CDC is for all flu-like conditions. So all respiratory illnesses, is the words they use. So COVID, flu, RSV. You should stay home until you're 24 hours fever-free and your symptoms are improving. And then you should wear a well-fitting mask for the remainder of your 10 days from onset of symptoms.
What if you don't have a fever?
So you should go by your symptoms. If you're improving, then you're good enough to return to work.
And no fever, positive for COVID, you can go to work.
Well, if you don't have any symptoms,
That's what I mean,
you should
yeah.
mask, yeah.
And the website's still supported if you were to have, let's say, be a municipal leader and stockpiled a lot of COVID tests.
I
A year
will
or
say
three
that
ago.
I used expired tests and they lit up.
Yeah, so.
So the thing is to wear a mask when you go back to work, because when I called,
That's the official recommendation.
gotcha,
However, there's no teeth behind it, so to
Gotcha.
speak.
okay, because that's what I said, out of courtesy.
Yeah,
There's
Put
no
sugar
longer
wood,
mask
right?
police.
correct.
So I've reached out to Dave Harrison because I had a lot of older tests and he gave me an extended expiration on those tests. They're still good.
Yeah, you can look up I think it's the FDA that has you can look up the serial numbers for what you got,
I didn't know
because they
that.
did extend quite a few of them.
New York
And again,
State,
the ones that I had did not get extended and they still work.
New York State, when you look up COVID, it mentions no mask. It says 5 days, I think. If no symptoms, you can.
Yeah.
They've taken down
We
almost
have to
everything
follow
off their
their-
site.
It's really not much.
Yeah.
Anyway, okay.
So we follow New York State as opposed to CDC? Because our town resolution was CDC, not New York State. I didn't realize that.
So New York State does mimic CDC, but it's, CDC didn't make certain statements that I think New York State kind of did take a little bit of a stronger stance.
Okay. I'll compare the two. Thank you.
No, I think I was going about CDC as well.
We had to have it in the resolution.
Okay, any further questions for Dr. McGann? Thank you very much.
Thank you.
Next up, Commissioner Gibson.
I didn't get to amend to take off any backfills because it's already scanned in. So,
That's okay.
but
We'll
be removing it.
I rescind that much of each resolution, as I said this morning. Thank you. This is nice big print. So it's very helpful. So I took these positions, and that's all I have on my agenda today, before the point one committee. So I just want to start with that. Asking to fill a full-time transportation aid position, vacant due to employees' resignation.
All right, do I have a motion?
I'll move it.
Further discussion?
For those that weren't at, the point one committee, being that we have, no emergency fills without going through point one, or, we're having a freeze, we're taking off, if we do decide if it's health and safety, we're gonna take off the term, and any backfills. That way, departments will have to come to committee for each individual position.
Okay, all in favor? Aye. Opposed? Carried.
That's your caseworker one.
Oh, did you move that?
Yeah, I did, sorry.
The second request is to, fill a full-time caseworker position.
I'll move it.
Second it. Further discussion? All in favor?
Aye.
Opposed? Carried.
The third request is to fill a full-time social welfare examiner position.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
The next is to fill a full-time social welfare examiner position.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And finally, after Ann, retired and came back to be part-time, we did bring Jill Delaney from the DA's office. She's operating in a position that is not the assistant to the commissioner position, because we didn't want to overlap that, and she needed to get her training, but now she's been fully trained and that position is vacant, so I'm asking to place her into that now.
Do I have a motion?
I'll move it.
Do I have a second? Further discussion? All in favor?
Aye.
Opposed? Carried.
I'm sorry, I didn't know what NBU meant. NBU.
Non-bargaining unit.
Thank you.
I knew that too. I just.
Just testing the committee.
It was a pregnant pause.
I'm sorry, what do we got here? Okay, so this is a contract to amend our current agreement with Greater Hudson Promise Neighborhood to add the provision of various prevention programs, including but not limited to after-school and truancy programs, the van and transport, Oakdale transport, field trips, boxing programs, Bindle stiff nutrition. So, they're a major partner, as you can see now, and they work with these different groups, and we go through Greater Hudson, who then does separate contracts with these folks, but as the youth.
Second.
Further discussion?
I'd just like to say I'm glad that this very reliable partner has the capacity to do this with us.
Yeah.
They're quite impressive.
All in favor?
Aye.
Opposed? Carried.
These are our numbers, and they speak for themselves, and you see the homeless numbers. Supervisor Adams has been at my office a couple of times since last we met. We're working on a couple of things, but one of the things we're working on is one of the hotel owners out in Canaan has indicated a willingness to become much more of a partner with DSS. To maybe set aside rooms just exclusively for DSS. We're going to further those discussions next month. My staff's very excited about that. So we're going to be actually out at the hotel. We're going to look at the rooms and the like, and with an eye towards, we hope, building that relationship as we have with Galvin. And we're not certainly at that point, but we're very excited that they right now just want to offer rooms to us. And I want to thank Supervisor Adams to really help bringing that conversation in together. So that's the good news. The tough news is we're really not sure where we're going to be in 4 months, 5 months, if we have a classic, and we may not, but if we have a classic Northeast winter, we're very concerned about that. We see these numbers really going up. So putting 13 more rooms online, which this would, which this would do, could help out a great deal on that score.
Supervisor.
Yeah.
When folks get placed as far out as Canaan, if they're from like the inner city of Hudson, what services you guys provide to make sure they're meeting their job search goals and stuff like that?
So transportation, we bring them in to do all of that. The hope is that we can start doing it out there, much like we do it at Galvin. Don't have that yet, but we'd like to build towards that. So right now they would come in.
That's what I was wondering.
We also, Claire, did a full inspection. Our code officer's gone through, we've made sure that all the rooms are clean, up to code, all the fire extinct, all the smoke alarms and carbon monoxide. So we know that we've got clean, healthy, sustainable site to work with.
Do you think that families will get sent out there first, or you're gonna wait for like singles to go further out before families?
Both. Yeah, and that's one of the discussions we want to have, because there's been families there. It's a little tough, right, when an operator is renting both to the public
Right.
and to us. So I think we've both come to the meeting of the minds on that. So
This hotel right here, sorry, where,
Jocelyn,
no, the one
St.
that's,
Charles?
yeah, what is going on with that hotel?
I don't know.
Is it operating? Is it open?
I don't know.
It says it's not supposed to be, but it looks like people are in and out of there.
And so we were just talking in the housing meeting, somebody said they had a rate posted online, so
So what is it?
I think it's a motel.
I think they've been renting a room. There was talk a while ago, probably 10 years ago, they wanted to make that a homeless shelter, but some of the city people lost their minds. over
Yeah,
that, so.
that's what the Easterbrook, like being in that, was a opinion, said, yes.
So,
But at one point, didn't we place individuals and or families in there?
We have,
Like very temporarily.
very temporary. I met with
Like weekend stays and stuff.
yeah, and through, Director Almasi's, programs, we've done that as well. But it's temporary. I met with the owner, because I think it switched hands about 4 or 5 years ago, just to gauge some interest that they might have, and he had none. He had none.
And is the warming station, the warming center online for this winter? We all good to go?
11-1. We open.
Terrific.
You know, I'm glad you brought that up. We will actually be having an opening where we'll be inviting elected officials to it, and there'll be a meal and a tour. We're just deciding on that date. It'll be a weekday at a time that's more convenient to you all, and we'll announce that. But yeah, 11-1.
11-1, all right, terrific.
One more question, sorry. Since we have time,
You never know with me.
what's that?
You never know with the meetings I run, right?
So just take family A that's homeless and they're placed someplace. Just like the next steps, they're not working, everybody's a little different, obviously, but let's just assume they're not working. So then what does social services do?
This is an interesting thing. So let's say it's a set of parents
Yep.
with 2 children. And that they're not working. Okay. Under the regulations as they stand now, they are exempt from job searching because of the children. We still provide that service. But under the regs as they stand presently, you are not in violation if you do not do that. If you're an individual,
I'm sorry, you're not in violation if you don't do what?
job search,
Then what is the reason behind that?
I don't even want to begin.
Okay, got it.
I just go with the regs and
Yeah.
we just go along with that. But we've had working with folks even in that situation. So,
And
where
most
there's-
people know that it's an expectation to job search, so like, people are still scared of losing their support if they don't do the job search, even though they don't have to. Most people are conditioned that if you're reaching out for social services and they're paying for your stay, you need to come into town and do your job searches. That's what I found with like advocating for folks, is that they want to do job searches.
And I don't know about, what kinds of jobs people are looking for, but Love's is chronically undershort.
Everyone
They're
seems to
looking
be.
for-
Everyone.
But they've been looking for 20 or 25 people for a year and a half, so there's plenty of work.
So the
Right
system
there.
is obviously somewhat flawed if you want to.
Well, it's just has to be relooked at,
Right,
right?
right.
Because you certainly have concern, and want to make sure parents, can be there for their children. Yeah, I think,
But the goal is to get individuals off of this, obviously.
well, it is, sure,
And,
sure.
for themselves,
For
better
everyone,
themselves, their self-esteem,
Forever.
their,
Where do
know,
they go?
Um,
No, where would they, both parents get a job, they got two kids, where do they go live? If they're not in the homeless program?
well, that's a whole nother problem, right?
Yes, it is.
And when that's the case, that's when I report to the board that I have people ready to move on, and what's next? And that happens.
meaning there's just not apartments.
There's not apartments.
But it also gets sticky when if they get a job and they start making an income and then they lose, it's possible for them to lose their shelter because they make too much.
Eligibility.
Right, they lose eligibility.
No, I know,
so
I have some
they go back
employees
in
doing that,
to
and it's
homeless.
like, but I don't want to get into it, but it's an awful
It's a tough
situation.
situation.
Yeah.
It's like, we had, at the board, my board meeting, they had people complaining, there was a husband and wife and two kids they were by Aldi's one day, and then they were out at,
Mhm.
and they had the sign, and it was disturbing to the people.
Well, people lose it.
But there are individuals that are part of
It's
these programs that have the ability to work and work more than they're currently working. They're afraid of losing, which is,
Which, I would like to address as well.
all the work they want, and they don't work.
Yes,
No, not all. Just saying my experience, I've had that.
no, I understand.
Yeah,
And there are some things like temporary assistance that they may fall out of, but SNAP may well, particularly with children, they would not lose that.
right.
And that needs to be out there, that they would not lose.
Sure.
SHIELD, they would not lose that. Medicaid, they would not lose.
Right.
eligibility.
But don't they reduce it? Do they,
Well,
they
it
reduce the
depends.
right?
I mean, if they get to a level where they're gonna reduce your heat and because that is a wide range, then you're actually must be doing a little bit better.
I think this committee at some point, maybe not soon, but like when we find good language, we should write a resolution in support of making the services available to folks match incomes that are available, because somebody could get a job at McDonald's and then they lose eligibility for something like SNAP, even with two kids, because their prices are going up for what they're able to pay people. And that doesn't match up with what eligibility looks like. Cause I myself have gone to apply because I'm out of work for the moment and only have this, but I'm this much above the margin where I don't even qualify for food stamps with 3 kids as a single person. And I'm not making a living wage. So, I think we should send some message that the state should be working with the federal government to make sure that we're indexing in a way that actually trickles down to our people.
Can I talk to you about this offline? I'd like to talk to you about that. Okay.
Well, yeah, I would too, because it seems to me, particularly if you're out of work,
This
having
counts as income, so.
put you over with 3 children. That's a real problem.
When you finished your answer to Rob's question, you said individual. You didn't get to tell us about what happens for an individual.
So an individual, yeah, that's governed by the regulations that you have to do your job searches. You have to be engaged in any services that have been recommended to you. We put a lot of resource into matching you up with services to do that. So there are certain.
So the individual that we're providing housing for, they get a job
Mhm.
and they can make $600-700 a week,
Mhm.
and they don't show up to work and they do whatever, and then they come back and you have to put them back through the program, correct?
Yeah, that can get difficult too, because why are they not working?
Right.
Can factor into it. And that's not so if there are children involved. but-
Right, I'm an individual, yeah.
Yeah, you don't really want to voluntarily leave the workforce, and you don't want to voluntarily leave housing, as an individual, because under the regs,
So there's a bigger problem.
But even with Chris Brown's latest numbers, there's like 106 rentals in the county. 2 of them are available to 60% of AMI.
Correct.
Or even 80% of AMI. So it's just the fear of, very difficult.
There's no place to go. There's homeless and then there's transition and then there's.
There's lots of different individuals vying for these apartments.
Yeah.
There are, I don't want to use the right term, I'll just say immigrants that are here, that,
Asylum seekers?
immigrants that are here that are also vying for these apartments, because they're having a difficult time finding places to live. So you have that group, you have this group, you have all of these groups of people that are trying to get to one apartment that's available. And, it's a challenge. It's a challenge for landlords. It's a challenge for everybody. And there's not that many apartments. I mean, I know what's available in the county. There's just not that many. So,
Those are the market forces at work.
yeah.
So, yeah, that's why they would remain and have remained.
So I apologize for not preparing for this question. Heap numbers are high as well. Is heap season open?
Just about.
Okay, and these, I'm assuming the reason they're so high is because they're cooling numbers as opposed to heating numbers.
No,
There was seasonal heat, there wasn't there for the
Yes.
summer, there was emergency heat.
Because
available.
the heat numbers are pretty high as well.
Yeah.
Will that bucket be as big or bigger this year? Do we know anything about the bucket? What will that?
I'm gonna guess it'll be slightly bigger.
Okay.
But that is subject, to more than, that don't look at my run of the mill, clientele, because there's a lot of eligibility when it comes to heating, right? So,
But it's still income based.
It is income based, right?
yes, but
How much?
But it's elderly, it's.
Yeah,
it's all-
they're stretched.
That's who
We have
like
emergency assistants that, pretty much anybody
Okay,
can get.
thank you.
Okay, so.
Thank you.
Thanks, appreciate it.
Thank you, Mr. Mayor.
Thank you, Commissioner.
Thank you.
Director Grandinetti.
I just had some updates.
Yeah.
That's okay. So the 2024 summer season, camp has concluded. Benissel Circus, went to 6 different camps and performed. The 2024 claims and annual reports are coming in now, as our October 1st to September 30th is our calendar year. MOUs for the summer camp transportation are headed out to the 5 different towns that seek funding for that. This is about what you can like about a little commission. The Chatham Fair Sensory Safe Room. So I'm going to go out there next week because we're trying to fix it up a little bit to get ready for the fair. But we also wanted to do like a photo op or have some board members come out. Do you want to speak to that?
Yeah, just that, so it's next Thursday.
You can catch me on a beanbag and I won't even be there for a photo op. It's nice in there. You get away from the fair. You're just like hanging out
Now I know where
here.
to find you.
We make close.
I'm not gonna ask them to serve beer or anything, but
Well, I would invite, all the supervisors to, if you can, it's really a great space. The director will be out there Thursday. Dan, what time did you think? About noon. So if you could make it by, I think that would be a nice show of support.
And so we did have funding set aside to kind of insulate the building, but they didn't have the capacity to do it. So it's going to be a lot like last year. So still a good place, but we look to do some more insulation.
that upper air shaft,
Yeah.
Who didn't have the capacity? We couldn't hire
Cornell.
Amanda? Oh, Cornell did. Okay.
And then the Think Differently program, we do have a proposal, and I know the commissioner's working through the board to figure out what we're going to do this coming year.
And doesn't Congressman Molinaro have a Think Differently event this week or next?
an hour today.
Yeah. Yeah. So it's getting a little extra out there.
Yes, and what you just mentioned just shows that we're not totally communicated. But that would have been helpful for our community to know that existed.
Okay, I'm sorry, I didn't for me to check the distribution.
Oh, no, that's
schedule in the
okay. I'm
future.
just, I think we would, and I know they're going throughout different counties in this region. But it would be nice to have, because I think last year you did go to that, didn't you, Supervisor Cummings?
I was there, Chairman Morrell was there.
Oh, this year as well?
No,
No, this year.
Last year.
It was this morning, yeah.
I had meetings all morning, so.
All right, so then our Youth Advisory Board meets on October 9th. The 2025 allocations are being set up and the contracts go out in October. Our funding was down a couple $1,000 and our infrastructure funding that we got last year was a one-term, one deal thing. So I let Jim know, and he's got our budget up to date. Let's see, our parents as driving partners, we sold 51, I'm sorry, in July, and 365 to date for the first year, so that's not too bad. And all of our program evaluations, all 17 of them are completed, and the next set are not due till 2026.
Great job.
So who's the best local elected official at a higher level that we can strong arm to get the youth camps more money?
I think I did put a gentle.
That we can speak to and address politely.
And they-
Rephrase that.
They sent back an email acknowledging Columbia County's gentle complaint about
Nudge.
the funding, yeah.
A little neat.
Thank you, Director. Any questions for Director Granigan? Great.
Thank you,
Thank you. Okay, next up, Director Lawson.
Good evening, everybody, or afternoon, excuse me.
Good day.
It has been so far, let's not jinx it.
Yeah.
Just 4 resolutions. We'll start off with a financial resolution. This is a request to extend warranties on a number of laptops that we utilize at the Department of Human Services. It would, of course, be more reasonable to extend the warranty than it would be to swap them out. So I ask for your support in and for a warranty program.
Do I have a motion?
Of course. Have you worked with MIS on this?
Absolutely, they're the ones that brought this to us. This is
Okay.
based on their suggestion and recommendation.
I'll make the motion.
And I'll second.
Further discussion? All in favor?
Aye.
Opposed?
First general resolution has to do with contracting with the presenter. The Department of Human Services intends to have a staff development appreciation day on October 4th. We would like to bring this presenter, and that's been recommended by one of our clinical supervisors, to offer a training as part of the development portion of the day on trauma.
I'll move it.
So I have a second. Further discussion? All in favor? Aye. Opposed? Carried.
Our second general resolution is in regard to a provider and a software known as Televox. This is an appointment confirmation software. We currently have an appointment confirmation software, which is okay-ish. This takes it to the next level, has a lot of new features, very appealing features, actually. And remarkably, it doesn't come at any additional cost, but because it's a new product, we have to contract with them. So I ask for your support in pivoting to Televox as our appointment confirmation provider and software.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And then the last general resolution is so that we can contract with Pace University. One of our psychiatric nurse practitioners intends to take on a student. And in order to do that, we need to have a contract with the learning institution. In this case, it's Pace University. So I ask for your support in that regard.
I'll move it.
Only if they're obligated to work for us for the next 10 years.
Right, yeah, right.
I had a motion and a second. Further discussion? All in favor?
Aye.
Opposed? Carried.
They come at no cost, so I think it's a no-brainer.
Yeah.
If I may, there's just one announcement that I would like to share with everybody since the last home committee. So first of all, thank you very much to all of the county leadership for its support in regard to using the ARPA funds to support the Wellness Hub and the development contract between Greenberger Center and RUPCO. What I've learned since is that Gateway of Hudson Valley has expressed an interest in operating what would turn out to be the third leg of the Wellness Hub. We have the homeless shelter and we have the 35 units of housing. And there's been some uncertainty and nebulousness, let's just say, about the third leg and what that would look like. So New York State Office of Mental Health has been in communication with myself and other individuals here in Columbia County about issuing an RFP for a program known as 120-day step down. This would be offering capital funds as well as operational funds for between 10 up to 15 units is the max, I believe. And Gateway of Hudson Valley has said they would like to be the operator should we be successful in acquiring that RFP, successful in our proposal, which I think we are pretty much guaranteed to be successful. So now that we have found an operator, this is a really, really good thing in terms of that continuum. We can have a person show up at the homeless shelter, get stabilized, get their needs met. They can move on to the 120-day step down program that Gateway will operate. And then from there, they will either move on, if the stars align, to, let's say, an apartment in the community, but we know how difficult that is. And if not to an apartment in the community, maybe over to one of the 35 units of permanent housing that are being discussed as part of the proposal. So this rounds it out in a really nice way. I'm very grateful to Gateway. Again, they're another powerhouse provider from Ulster County, similar to Rupco. They're not a developer. They're a provider of services, housing services, behavioral health services. They provide a PROS program and several other behavioral health type programs in Ulster and surrounding counties. So they bring with them a wealth of resources and information. And, I'm just excited to have them. The one Achilles heel or negative to this whole thing is the staffing composition that is required, because the state is offering operational funding to the tune of $100,000+ per unit. So simple math, if you do 10 units, they're giving you $1 million. They're giving you that much money because of the staffing composition. All told, it's about close to 20 FTEs to staff these units. So we're talking about a nurse practitioner, licensed clinical social worker, vocational specialist, peer specialist, and then the residential staff that have to be there during all hours of the day to watch the occupants. That is a huge challenge, given the workforce issues that we're all struggling with. I appealed to the New York State Office of Mental Health and asked them to consider offering us a waiver or a modification in the RFP. They, of course, declined because they said, how could we oblige that request when we've issued the RFP to other counties? In fact, Gateway was awarded this RFP in Ulster County. So they were foul is what would be happening. But nonetheless, it doesn't hurt to ask. I also asked if they would offer any financial incentives to the operator so that when they went about hiring, they could maybe give hiring bonuses and such. The answer was no. Despite those declinations on the state's part, Gateway still came in and said, we want to do this for you. So I think it's very exciting, and we'll round out the wellness hub, assuming everything comes together with the wellness hub in the way that we hope and expect, in a really nice way. So thank you for that.
So that's 1.5 to 2 FTEs for every unit? 15 to 20 units?
All of those individuals would be serving each and every occupant of each unit.
Right.
But yes, you do the math, it breaks out to something like that.
Right.
It's a very, very robust staffing model, because the idea is they call them wraparound services. It's kind of like what it sounds. You are throwing everything but the kitchen sink at that individual in an attempt to stabilize them, to send them on their way when you hit that 121st day, so that they are stable, well prepared, able to thrive and launch and go about on their own. That 120-day is flexible. I've been told by the state, as long as the person is participating and involved with the services and program, they're not going to be kicked out, put on the street, so to speak. So I'm grateful for that flexibility, but it's an incredibly ambitious staffing model for what the reality is. I even asked the state, I said, look, if we come in at 10 units, let's just say, the least number of units, could we not justify needing less staff to wrap around those individuals? And they didn't want to hear it.
So what I was thinking is, because of the synergies between the 3 legs of the stool, so to speak, could you share staff between those agencies and reduce the number of overall staff required?
No, is the short answer, because
Okay.
different entities are overseeing and operating the different models, the different legs, so to speak.
Okay,
We thought about that, we talked about that. Short answer is no, unfortunately.
But Gateways will be employing this group. Now, we don't want Gateways poaching your staff
Agreed.
with competitive salaries either,
Right.
right? So,
Everybody is going to be siphoning off of the same body of pool of candidates, let's put it that way, as we have a lot of exciting things happening. We have the potential for the wellness hub to, create these entities like the homeless shelter, the housing, and now the 120-day. We have, Twin Counties has, got the nod from Oasis regarding a capital project at, I think it's 94 Healy Boulevard. Are people aware of this, or maybe not so aware of it? Sorry? Relocating the services of the Red Door, but expanding the services as well. So I only mention that because they're going to be looking for, staff to then offer that service. And they are well on their way to being shovel ready in regard to that. So they're a little bit ahead of the game, as opposed to the Wellness Hub is a little bit behind.
did you say 94 units?
No, 94 Healy Boulevard, I believe
94
is the
Union
address.
Boulevard,
How
okay.
much
How
bigger
many
is it gonna
units?
be, you know? Yes.
I'm not sure how many people they intend to serve. It's going to be, stabilization, they call it program stabilization, rehabilitation, and reintegration. These are 3 different levels that one can participate in based on their need. And you can move from one to the other as you progress. So it would be hard for me to say I would need to be coached by Keith Stack, the lead on this, or you'd have to speak to him to kind of
Yeah,
understand the
well, I don't
model.
remember, because I remember the presentation of the model plan and program, I don't remember it now.
Yeah. So that's really it. Thank you very much for your time and your ongoing support.
That
Any
space,
questions?
that space on that Twin Counties is gonna vacate,
No, they will,
or they're gonna keep the current space?
yes, they will keep the Red
Okay.
Door and use it in a different way.
Okay,
Again, I think they're.
I was thinking
taking
that
around-
other housing project where you were looking.
Yes. I know, I thought of that too, but when I approached Keith, he said, no, we're holding on to it.
Okay.
thank you very much, Director.
Appreciate it, everybody.
Thank you.
Okay, last but not least, Office of the Agent.
The last as usual.
There you go.
All right, so for anyone who doesn't know me, Nina Bonzuto, the new administrator, we've got my second, afternoon, Ken Shoemaker. So we're gonna start off with the first resolution. I put a big red line through that backfill piece, so we're pulling that out. This is for our position of nutrition services coordinator. This is kind of a sink or swim position. This is the person who is in charge of the programmatic development, implementation operations out at our kitchen. So that's overseeing our home delivered meals program, our senior community centers. There are other vacancies out at the kitchen, and I think we would be okay without those, but this one, we gotta have it.
I'll move it.
Second. Further discussion? Your retiree did a great job. And thank her on behalf of all of
There were
us.
lots of tears at breakfast this morning.
Yeah,
Bittersweet. So she'll be officially done on Friday. I told her it's not too late, but she's gone. She's not gonna stick around.
all in favor?
Aye.
Opposed? Carried.
The next one, thank you, is for our, a potential new partnership with the Questar 3 BOCES internship program. I'm personally very excited about this because this is the exact program, pre-employment transition services that I kind of came from before I came into, the county. So this, John Levine over at Questar reached out to us and asked if we would be interested in taking on 2 to 3 students between the ages of 17 and 21. These would not be county employees. They would be covered by, and there's a letter that went along with this, from John, they would be covered by their insurance and liabilities. It would be about 1.5 to 2 hours, 1 time a week with these students and a job coach on site. If this sounds like something people are interested in, I'm then going to sit down with John and come up with a specific work plan for them, kind of
spread them around aging services, you know, really, first of all, presume competence, look at some of their strengths and interests, and then use that to our advantage and their advantage, help them learn job skills, get experience, build up their resume, potentially introduce the new, you know, workforce to aging services, and hopefully you don't steal them from us in the future. And we bounce them around between our office, out of the kitchen, you know, maybe work on some of the newsletter, putting that together, stuffing envelopes, sending those out, doing meal routes, delivering delivered meals, helping out at the senior centers, maybe doing some food prep out at the kitchen. So we probably try and give them a little bit of everything.
I'll move it.
Second.
Is there written documentation?
Meaning, would I be
Between us-
doing the report?
No, between us and Questar. Is there an agreement?
Yes, if it's the same program that I used when I was at Habitat, there is a document for each student.
I believe that there will be,
So I'll vote for pending county attorney's approval.
who I did reach out to,
Okay.
haven't heard back.
It's a great program.
Checked with HR on this, and
And then, yes, Craig Simmons used them too, I think.
The auto program.
Yeah, but I know that we used it in the offices and the kids just add a great value added to the community. So good luck with that.
Okay, do you want to pick up the gauntlet you threw down in front of Director Almas about stealing employees? Okay, all in favor? Aye. Opposed? Carried.
we'll train them on the for you. Thank you. Last one is less exciting, but still very important. This is the usual contract with Healthcare Consortium for our New York Connects program.
I'll move it.
Second. Further discussion? All in favor? Aye. Opposed? Carried.
Thank you. Oh, and just a reminder, our senior day will be Thursday, September 12th. 10:30 to 10:30 to 2:30.
Stuyvesant.
Stuyvesant Falls.
BMW.
Yeah, thank you.
I'm sorry, September 12th.
September
Yeah.
12th, 10:30 to 2:30. If you're thinking of stopping by, let us know so we can make sure there's barbecue chicken for you. Sound quick.
Chicken.
Oh, now. he wants to come.
It's a lovely event and the Department of Health will be there, correct?
The party animals theme this year. We have the Columbia Green Humane Society coming as our guest runner. They, as of right now, are bringing a dog. It's very important. Dogs and barbecue chicken.
There you go.
That's all you need.
My two favorite things.
Thank you.
Thank you.
Thank you. Okay, anything from the supervisors? Anything from the public? There being none, I have a motion to adjourn. Do I have a second? All in favor?
Aye.
Opposed? Good night, everyone.
Thank you.